Mr. Chancellor, over the course of her distinguished career, Patricia Benner has profoundly shaped how we think about the lifelong education and practice of nursing. The American Academy of Nursing has literally, and most deservedly, recognized her as a living legend. Born in Virginia, Patricia Benner earned her Bachelor of Arts degree in nursing from Pasadena College in 1964, then embarked on a career on the front lines of nursing, working as a head nurse on the coronary care unit at Kansas City General Hospital, and as an intensive care staff nurse at the Stanford University Hospital. After earning a Master of Science in Medical Surgical Nursing degree from the University of California at San Francisco in 1970, she then completed her PhD at UC Berkeley in 1982 and returned to the University of California, San Francisco as a member of the School of Nursing faculty, where she is now Professor Emerita. Tout au long de sa carrière, la professeure Benner a défendu avec passion l'importance des connaissances des premières lignes en soins infirmiers. En effet, les soins infirmiers de première ligne sont au cœur de son concept visionnaire de novice à expert, lequel reconnaît que l'excellence en soins infirmiers est le résultat à la fois de solides fondements académiques et de connaissances acquises grâce à l'expérience clinique. For Professor Benner, frontline nursing knowledge is not only essential for advancing clinical practice, but managerial practice as well. She has insisted that direct patient care must inform managerial practices in order to meaningfully improve staff development and, in her words, to truly make our hospitals and medical centers better learning organizations so that we're teaching to all of the changes that are occurring all of the time. We are truly impoverished when we do not have the nursing voice in the leadership arenas and in the policy arenas. If there's a single theme running through Professor Benner's research, it is compassion. She has advanced our ideas of end-of-life care in critical care settings, exploring pain management, the transition from curative to palliative care, and medically assisted dying. Through her careful, thoughtful exploration of the power of self-improving practice, Professor Benner challenges us to grow into our best selves. She pushes us to find opportunity and change. When we see something excelling where we're struggling, she teaches us to ask, what are they doing that I could be doing? Through her inspiring writing, her profound insights, and her committed membership to generations of nurses, Professor Benner has shown us that every day is a new opportunity to sow the seeds for a better tomorrow. Mr. Chancellor, I present to you Patricia Benner so that you may confer upon her the degree of Doctor of Science, honoris causa.
So I'll now call upon Dr. Benner to come up and give her address to all of us. Thank you.
It really is a lot about the hat. It's truly wonderful. I am so honored to be here. Chancellor McCall McBain, Principal and Vice Chancellor Fortier, Mr. Panda, Chair of the Board of Governors, proud families and guests, and most of all, the graduating class of 2022. Congratulations as you begin your professional, your various professional journeys. I have studied the development of expertise in nursing and actually other healthcare fields. Expertise is not a trait or a talent, even though we all feel like it probably is, but it isn't. It's born of experiential learning. That is, having your preconceptions turned around, discovering something new, which is made possible by skills of involvement, openness, curiosity, responsiveness, and learning from failures. Expert clinicians describe rapid clinical reasoning. For example, in caring for an acute burn patient, the nurse titrates vasopressors, pain medications, while monitoring oxygen saturations, CO2 levels, checking to make sure the blood is perfusing in that burn patient's fingertips, and all the while communicating with the patient and the wife. I've watched an occupational therapist enter a 4-year-old exhausted from Mass General's 5 hours of investigative treatment, tests, and decide, I will only do this assessment through play, and masterful assessment through play. So expertise is a generous and wonderful thing to watch because the person is so present, so involved. But these things that I've described are not lists of things to do for the expert, but are rather based on salient, attentive, integrated care for the patient's well-being in the moment. Expert practice can't be described by static accounts of knowing that and about, and tragically, that's just about the only descriptive language we have, and it does a disservice to expertise. Describing expert performance requires multi-layered accounts of situated use of knowledge, illustrating knowing how to do something and when to do it and why, and then having the expertise to carry it off. Nurse Terry Holden tells the story of Joan, who in her early 50s was admitted to the intensive care unit, critically ill with multiple organ failure as a result of childhood rheumatic fever. And I add, as a backstory, the inequitable health care delivery in the U.S. Joan was disoriented, combative, and malnourished due to her heart and liver failure. She also had anxiety attacks, which wreaked havoc on her vital signs that could not be treated with more medications. Occupational therapists found rainstorm tapes that calmed Joan's anxiety without meds. Nurse Terry Holden notes that as Joan's confusion lessened, she proved to be a delightful person with a lively sense of humor. After 2 months, Joan was well enough to undergo a triple heart valve replacement. To rehearse for the surgery, the medical resident, physical therapist, respiratory therapist, nurses, and other staff members took Joan in her hospital bed with all the IVs to see the lights of Chicago. They knew of Joan's fear of leaving the room, believing that she would not return alive. The trip was fun and festive. 2 days later, Joan's triple heart valve replacement was successful. After discharge, Joan returned to thank the staff proudly, claiming that she was walking, taking care of her home, singing in the choir, and sleeping with only one pillow. A triple heart valve replacement is a major human accomplishment and example of expertise. But 2 months of coordinated, constant, attentive care. Remember all those vasopressors? She never got off of dobutamine. On coming to their attentive care based on coming to know Joan as a person is an equally stunning human accomplishment. In one of our studies of skill acquisition in nursing, we found that nurses without skills of involvement did not become experts. They did not develop a practice. They had little or no narrative memory of their patients, and they did not organize their care according to the patient's most urgent need. I would hear statements like, well, I can't remember if it's morphine or Valium. Well, that's a qualitative distinction. That's, failure to develop good skills of involvement blocks experiential learning and the development of expertise. So skills of involvement are some of the most important skills you will take with you from McGill to master your profession. A large amount of research on the pathologies of involvement exists, and we all know those fearfully: over-identification, leaping in and taking over, the problems of implicit racial and class biases causing healthcare inequities, and many, many more. Caregiving is one of the occupations that everyone writes about as dangers of burnout. You know, skydiving, not so much, but caregiving, that could cause burnout. Studying faulty skills of involvement is essential, but it is just as essential to study the less understood positive skills of engagement. My mentor is Dr. Hubert Dreyfus at UC Berkeley, and McGill's internationally renowned professor Charles Taylor, who, by the way, he and Dr. Dreyfus had this intellectual partnership for over 70 years. They both point out that our cultural ideals of detachment and disengagement stem in part from the widespread acceptance of Descartes' view of the mind, with its accompanying social imagination of human beings as separate, atomistic individuals standing over against an objective world. Descartes believed that we access the world through mental concepts and ideas lodged in the mind, separate from the body and the world. This view has been disproven in current neurocognitive sciences, replaced with a view of the mind as socially embedded. But that ideal vision of detachment is a kind of folk psychology that we all struggle with, rather than the view of the embodied, embedded, socially embedded person who's usually involved and engaged in a particular project. We distort and devalue experiential learning by a wish dream that we be guided only by theory and science so thoroughly that we never make mistakes and are never surprised by anything, even a missing speech, right? I quote William Osler, whom many consider the father of modern medicine, a McGill University graduate and a McGill University professor of medicine from 1874 to 1884. The good physician treats the disease. The great physician treats the patient who has the disease. He who studies medicine without books sails on an uncharted sea, but he who studies medicine without patience does not go to sea at all. As a consummate clinician, William Osler wanted to learn about disease and the person's illness experience firsthand from talking and examining the patient. Students, and he also touted the important notion that if the number one thing you need to succeed was to be interested in your profession. Students are taught the virtue of applying theory to practice, often as if practice were an inert, passive thing instead of being a self-improving, organized study, socially embedded and embodied form of knowledge with notions of good internal to it. And when you study a practice discipline, you also are engaged in formation of the habits of responsibility, attentiveness, and skill that are required to carry out that practice with high fidelity. Practice is comprised of skillful practitioners, and it is a way of knowing in its own right. Practice is a source of knowledge for science and theory. Practice, theory, and science are intertwined, as the McGill Medical School's motto depicts: patience at heart, science in hand. I trust, graduates, that you will hone your skills of involvement and learn directly from your patients, and that you all will become experts, engaged and interested in your profession. I am confident that by becoming experts in your practice, you will become wise in your lives as you do essential and significant work. I congratulate you.